beautiful patients here. Long-time patient. She looks amazing, and she always is great on social media. If you guys want to DM us, we can get her information. No, I'm kidding. We just did her skin. We prepped her skin before we were going to do some fillers. She just had an aqua gold facial. Take a look at her skin. It's very bright. It's rejuvenated. We're going to get into our lasers to get rid of some sun damage and some brown spots and peels in the future. But her maintenance is to be getting her facials, keeping the skin extracted. She has almost no pores and she looks great. So that's what I call the red carpet glow. You could basically do that treatment every month and look really good and rejuvenated. And there's all different types of facials that are there. The aqua gold one does stamping of neurotoxins and filler and vitamins into the skin. It really helps if you have redness, if you have oiliness or enlarged pores. It also does a little bit of skin tightening that I like. And if you have fine wrinkles and you don't get Botox like me, I do a lot of peels, but I don't do Botox. I know you guys are gonna go crazy if I say I don't do Botox, but that's the truth. I do have some movement lines, but at rest, I don't have many because I do lots of peels and lasers. So our next step for her is gonna be lasers, but what we're gonna do today is I'm gonna do some collagen production and some filling of lines with Radiesse. And the reason I like this for her is she has great volume through here, great definition through here. Everything looks great. I notice a little bit of sort of sagging through the lower part of the mouth and around the mouth. So we're gonna use Radiesse here because we've talked about this the other day. With diluted version of the Radiesse, you get a building of collagen in that area. And so she's gonna get what we call the anatomical lifting, the structuring in that area so the marionettes are less, the jowls are less, and the wrinkles are improved. So look up for me. I know, who smiles before they get fillers, okay? Only her. No, I'm kidding. In my office, everybody. So we're gonna do a little pinch. I'm gonna show you guys today with the cannula injection. We're gonna do our treatment. And the reason I like this for her is we're gonna minimize bruising because she looks really good after her facial, but also because then I can go to 2 different locations. So you're just gonna feel a little pinch, 1, 2, 3, and we're gonna go up to that point, what we call the piriform aperture, which is right here. So this is going to allow me to get larger sort of volume to where I wanna get lifting in the fold. And I'm just going slow because it feels weird with the cannula. Are they saying anything there?
Alright, so it said, does that hurt her? Guys, our patient was numb topically.
And there's numbing inside as well.
No pain.
She's probably one of the strongest, she's superwoman basically. Okay, so again, what I'm gonna do is rotate then the filler. Now she has some good collagen production, there we go. Up to the piriform right there. Just we don't want it to be aggressive. I just want it to be improved. So look at the depth on the one side, look at the depth now on the other. I'm gonna stay on this side. So we're filling it out, but again, this is long-term collagen production. So we're gonna get building. Now the next part we're gonna do, so you can see it's much softer. So now what I'm gonna do is look up with your chin as high as you can. This sort of triangle here, we call this the pre-jowl sulcus area. We're going to use a cannula. This is a very European technique. I've been doing it for many years. And we're gonna go to what we call the lower cutaneous lip. Feels weird, it's not the best feeling in the world. But we're gonna kind of thread right across this triangle and give some support. And we're gonna go up into the marionette. Look a little more left. Perfect. Always looks a little more swollen at first. But then again, remember, this is gonna blend and it's gonna support her chin, it's gonna support her pre-jowl, and this whole area here. So that it builds collagen, so kind of seeding it throughout this area. And then again, I'm trying to blend the edge of the nasolabial fold into the marionette. Sorry, a little pinch here.
No problem.
There we go, right up to the corner of the lip. Perfect. And so that's the reason I like this is it blends this entire area from fold to chin to marionette. And look at the difference from one side to the other. Now we're gonna go to the other side. What do you guys see?
Beauty.
We see a big difference right here.
Awesome. And that's only one syringe. So really, yeah, that is a big difference actually. So
Yeah.
take a look already. Show her really quick if you can. Yeah, I can. Hold on. Take a look really quickly at this side versus
Oh.
this side.
Yeah,
That's already improved.
it's very much improved.
And I like it because this area, now what's gonna happen is this will seed into that area and build collagen. I'm gonna take a quick, hold this a second, I'm gonna take a quick side by side. All
And I
right,
do want everybody to know, there really is no discomfort, weird feeling, or pain.
I love that. All right, hold on one
Sure.
sec. Oh yeah, that's a big, you can see that, hold on. You're also very strong, but even if you weren't,
I'm
it's
well
really not
motivated.
bad.
I'm
Yeah, it's
just well
good
motivated.
mental attitude. It's all in the brain, you guys. If you think you're gonna have pain, you're gonna have pain. Okay.
If you think you're gonna be beautiful by Dr. Emer,
You
you're
will
gonna be
be.
beautiful.
Exactly. Beauty by Emer. Okay, lift up a little bit. You should be head of our marketing company. Okay, so now on this side, we're gonna do the same thing. And again, she has some fine wrinkle, but the point is we really wanna get this in there to build collagen over time, but also give some level of support to the deeper fold and the piriform, like I said. So again, we'll go nice and slow. And I've been using Radiesse now, you guys, for 15 years or so. Not to date myself, and it's a really great filler if you know what you're doing with it. There's a trend right now for people to be using it for the body. Just FYI.
We have some great videos using Radiesse dilute for hip dips and for
Exactly,
buttock
for the
lifting.
hip dips and cellulite.
She looks
It
excited.
works great. And again, I'm doing this in kind of different layers, so that's why there's a little sort of pressure. Trying to get it also on the bone so that we can give some support to the fold here. With a cannula, you limit the risk of bruising, swelling, and long-term issue. Perfect. I'm gonna go get the other amount.
How do you feel right now?
I feel comfortable, I feel well, and I can't wait to see the results.
And the results will be sort of immediate, but she's really gonna notice it the most in about 6 weeks or so. Okay, lift up and turn right slightly. Good. So we're gonna do that same technique. Hold on. Okay. So again, this is the technique where we support the marionette. You don't want to use a lot of filler here because you don't want it to look puffy. But we also support the below the what we call the lower cutaneous lip and chin area. And that will give a lot of support deep so that the marionette and the lip crease don't fold over and get droopy. And then my last favorite part, even though we're focused on filler today, is to do around her eyes and bunny lines, because we've talked about this before. A lot of people, like you can see her skin's really smooth, and when she smiles, like she smiles all the time, smile. There's a little bit of creepiness that's here, so lasers will improve that, but using a little bit of toxin properly will allow me to get that improved. And what I like to do, especially since she has the lines that go out to the side and under the eye, smile again, relax, is we go a little bit closer and a little bit under so that we can improve the under eye wrinkles as well. Smile as big as you can, perfect. And we'll do that on the opposite side as well.
And I have to tell you, Dr. Emer,
What?
I am one of those people that gets the eyelid twitch.
During the treatment or
No,
after?
no, no, anytime.
Really?
Yeah,
Does
yeah.
it improve it with this or
The
no?
Botox, it disappears for 3
When,
months.
you know, it's crazy, when I was first starting you guys, I used to do Tourette's and spasm patients. That's why I do a lot of Botox on the neck.
On the neck.
Smile as big as you can, relax. I do it for myself even. So if you really know what you're doing, those twitches that people get, you
Mhm.
really can improve with the Botox.
It's been great.
Only thing you have to be a little careful about over here, you guys, is ensuring that you don't drop the eyelid. That's really the only thing, is if you do too much,
like that?
then the person looks like a Saint Bernard. Okay, so you gotta be really careful. You don't want the eyes to go like this, alright? You see how it's open too much, scleral show? So we keep it up, you just be really cautious. Now show us the bunny lines. Okay, relax. So you guys can see those lines here. We'll do a little bit here as well. Show me again. Relax.
I really think it's the
Show me
bunny
again.
lines that,
Relax. That one, Help the
that
twitch?
help the twitch.
probably. And then I usually use a little extra smile again, because you see how far out the lines
Yes.
come, so we go a little bit further out. Do a little extra there, and then I'm probably gonna do just a teeny bit more. Right there. Yeah, the bunny lines would help. It's all connected. All of this, so that's a good amount. Smile again. So again, relax. I wanna go kind of a little bit further out. And then smile again. Relax, and then come in a little bit closer here. So it's all connected, and that's it. So obviously we'll see an improvement with the tox over the next couple weeks, but the filler, let's show her really quick. Do an Emer reveal really quick.
All right, so we're gonna pass our patient the
Stay leaning
phone.
back a little bit. Yeah, and then we're gonna give you the phone. Look at yourself on the phone
All right,
And
here
let
you
us know
go.
what you
Here's the
think.
phone.
of the outcome
Hold it.
around the folds and on this area, right here.
Oh, that's terrific.
Turn a little this way, because what I want you to see is, you see how
That
now it's
lip,
more
yeah.
blended to the
Yes.
jaw, and obviously when the swelling goes down, this will be straighter, and then these will be up, which is what we wanted.
And that is what you said, if I can repeat. Something about the underlip and hanging over.
Droopy lip. We don't want you to have a droopy lip.
I think that's gonna take care of that.
Yeah, I think it's gonna be great.
Again, it'll just rejuvenate me without making me look like I've,
Yeah, I don't want you
Too
to have
much.
anything done. Exactly.
I just wanna look like a good version of me.
Perfect.
But,
So now look in the
Really
mirror,
happy.
because I think the mirror is actually easier to tell.
oh wow, yeah, the lighting, yes.
And obviously,
shadow
and the
as
cool
well.
thing about the Radiesse is it kind of seeds here, so right now if I grab, it's a little hard. That settles in the next 2 weeks, and then collagen fills in that area and it's softer. So it will smoothen out really nicely, especially when you do what we call hyper dilute, which is what we just did right now. It's gonna be great. All right, you guys, so female facial rejuvenation, not sculpting, rejuvenation. And just stay tuned, because we're gonna keep updating as we go into our next phase of treatment, laser.
Correct.
Perfect. All right, now you're